Here at this small rural hospital, a shipment of medicine is on its way right now. 16 patients have a prescription for it. A special delivery.
It's very high quality stuff.
I would say this is the gold standard by far.
By way of a doctor's orders.
This is prescription grade.
But this medicine is not meant to be a quick fix.
I think our patients that are committed have really enjoyed it.
And it is not sold in pill form, but by the ounce.
I think it's innovative, but we're almost going back to basics.
It's the oldest remedy of all.
It's a fancy butternut.
Fresh, real food.
I bought some bok choy.
These are ripened right on the vine.
More than 24 farmers and the Benson Hospital are finishing a 3-month pilot for produce prescriptions. 16 patients with diabetes and cardiovascular disease agree to buy $20 worth of locally grown produce each week, paid for with private grant money, and incorporate the food in their diets.
I'm eating more vegetables and I'm experimenting with cooking more, so that's fun.
Wendy Berry estimates she eats 50% more fresh food, and she has cut out most processed sugars. You've replaced something for candy.
Yes, dates. They're marvelous. It's like eating sweet custard.
Icy Grimes says her husband with diabetes is more inclined to eat healthier, knowing it's part of a medical plan.
He's lost 6.5 pounds, but his A1C's down quite a bit to a much better number.
First time I've seen a produce stand at a hospital.
Yeah, we're trying to be innovative.
Benson nurse and city council member Cindy Tapia
We're kind of in this together.
is tracking the health metrics of the participants and says they've seen positive results. Midway through the program, 9 of 13 participants tested showed blood pressure improvement. Average blood sugar levels also slightly decreased. 2 lost weight.
We want them to enjoy this. It shouldn't be something that they have to eat, and hopefully this will replace some of the, processed foods, sugary foods.
Let them know who we are, what we do.
Entrepreneur John Benedict says the concept of produce prescriptions is not new, but creating a way to cover the costs for low-income patients is rare.
Typically, you'll see where people are doing produce prescriptions, right? So you're attacking the health angle, but are you making it affordable to everybody? And if it is affordable and people know they want it, that's where you have to bring the mobile market, because a lot of people are struggling with transportation.
Benedict believes produce prescriptions can be a profitable model of healthcare.
Typically, this was seen as some hippie things, woo-woo, really weird. Now, with the hospital behind us, we have data, we know what works. Now we're in that phase. Let's take this to the legislatures. Let's go talk to Access. Let's see how we can get this covered for Arizona statewide.
One reason this seems to work here, the produce is top quality from small farms.
This is really high density. There's no pesticides, no herbicide.
I'm just so grateful.
On this last week of the 3-month pilot program, reality is setting in. This idea is taking root.
Like when I was going through school, this was my passion, is prevention and preventative care, and especially for my community. And to see it happen, it's amazing.
And for what it's worth, Wendy was right. The date's just as good as any other dessert. Joe Dana, 12 News.